Over 60, cancer could be hiding in these 8 symptoms you think are harmless. You've likely brushed off a few aches, a bit of tiredness, or changes in your body as just aging. But what if they weren't? Many cancers in people over 60 begin with symptoms so quiet, so ordinary, that they get missed. It's not about being scared, it's about being informed. Some signs may seem harmless, but could be warning bells you shouldn't ignore. Your body speaks to you, and it's time we listen closely. Let's look at 8 everyday symptoms that could be hiding something far more serious than they appear. If you're over 60, or care for someone who is, please take a moment to like this video and subscribe. These videos could help catch something early or help someone you love. We share trusted health tips to keep you stronger, safer, and more informed as you age. You're never alone here. Unexplained weight loss. Sudden, unexplained weight loss can be one of the earliest and most overlooked signs of cancer in people over 60. When weight drops by more than 5% of body mass in a short period, without changes in diet, activity level, or medication, it's not something to ignore. While it might seem like a welcome change to some, especially if extra pounds have been a concern in the past, doctors warn that rapid weight loss without effort can signal serious conditions, including cancers of the pancreas, stomach, lung, or esophagus. Pancreatic cancer is often known as a silent type because it tends to show few symptoms in its early stages. But one common early warning is unexpected weight loss. The same goes for stomach cancer, where a reduced appetite or early satiety may develop subtly, gradually making it hard for seniors to meet their usual nutritional needs. In cases of lung cancer, weight loss may result from the body burning more energy due to cancer's presence or because of appetite changes caused by the disease. Whatever the cancer type, weight loss often reflects the body's internal struggle, where cancer is using up nutrients or changing how the body processes food. Some older adults assume weight loss is a normal part of aging or due to stress, depression, or even retirement lifestyle shifts. While those factors can contribute, a sudden drop without a clear reason, especially when accompanied by fatigue, loss of appetite, or a general feeling of being unwell, deserves medical evaluation. Seniors are often more at risk because their bodies are already more sensitive to nutritional deficits and slower to recover if the cause is serious. Doctors suggest tracking any change in weight over time, even just stepping on the scale weekly. If there's a noticeable drop within a few weeks or months, especially if meals haven't changed, it's worth discussing with a physician. Blood tests, imaging, or further screenings can help identify or rule out serious conditions. Early diagnosis in many cancers significantly improves outcomes, and weight loss may be the only early sign that something is wrong. For seniors, maintaining weight is often a key part of staying strong, independent, and resilient. A sudden shift isn't always dangerous, but when it happens without an explanation, it's the body's way of asking for help. Responding to that early message can make all the difference. Persistent fatigue that lingers for weeks, no matter how much sleep is being had, is not just part of getting older. It can be a quiet signal that something deeper is going on, especially when rest doesn't help. Some cancers, such as leukemia, colon cancer, or lymphoma, begin with little more than a constant feeling of exhaustion. This isn't the usual tiredness from a busy day or a poor night's sleep. It's a bone-deep fatigue that makes even small tasks feel overwhelming, and it doesn't go away with naps or lighter schedules. In leukemia, cancer cells begin crowding out healthy blood cells, affecting the body's ability to carry oxygen and fight infections. This can lead to ongoing weakness, lightheadedness, and a tiredness that feels hard to describe but impossible to ignore. In colon cancer, slow internal blood loss may cause anemia, which reduces energy and leaves the body drained over time. Lymphoma, a cancer of the lymphatic system, also uses up the body's energy and immune resources, leading to fatigue even before other obvious signs appear. For seniors, it's easy to attribute tiredness to age, medication, or stress. But fatigue that sticks around, especially if it's new, getting worse, or affecting daily life, needs to be taken seriously. Doctors warn that if fatigue is accompanied by other subtle symptoms like unexplained bruising, night sweats, changes in appetite, or mild shortness of breath, it could be more than just aging. Often fatigue is one of the earliest signs, but because it's so common, it gets missed or brushed aside. A healthcare provider can run simple blood tests to check for anemia, infections, or markers that could point towards something more serious. Catching these signs early gives the best chance at treating or managing the cause effectively. Even if the result isn't cancer, addressing persistent fatigue is important for quality of life and daily functioning, especially in seniors who rely on stable energy to stay active and engaged. Listening to the body's signals becomes even more important with age. When energy fades without reason and sleep doesn't help, that's not something to ignore. It's a message worth acting on for safety, for health, and for peace of mind. Changes in bowel habits. Sudden or ongoing change in bowel habits is something that should never be dismissed, especially for adults over 60, whether it's chronic. Constipation, frequent diarrhea, narrower stools, or a constant feeling that the bowel hasn't emptied, these signs can be linked to more than just aging or diet changes. Doctors often point to these symptoms as possible early indicators of colon cancer, a condition that becomes significantly more common with age and often develops quietly before showing more alarming signs. Colon cancer often begins with subtle shifts in how the digestive system works. These can include going to the bathroom more or less often than usual, or a change in the consistency or shape of stool. Seniors may assume these issues are due to medications, reduced fiber, or even less physical activity. While those are all valid causes, persistent changes that last more than a few weeks should never be ignored. It's not uncommon for people to treat it with over-the-counter remedies, which may temporarily help, but they can also delay a proper diagnosis. In some cases, a tumor in the colon can partially block the passage of stool, leading to alternating patterns of diarrhea and constipation. In other cases, cancer may cause internal bleeding that isn't visible to the naked eye but leads to darker, tarry stools or mild anemia over time. That's why changes in bowel habits, especially when paired with fatigue, unintentional weight loss, or bloating, are seen by many medical professionals as red flags. Doctors recommend that any bowel symptoms lasting more than a few weeks should be reported and checked. A colonoscopy or stool-based test may be suggested, both of which are commonly used to detect problems early. Colon cancer is one of the most preventable and treatable forms of cancer when found early, and these small warning signs often offer the first, and sometimes only, chance to catch it in time. Seniors sometimes hesitate to talk about these symptoms, either from embarrassment or thinking it's not serious. But paying attention to the body's natural rhythms is an important part of staying healthy. If something doesn't feel right or stays different for longer than usual, it's better to check and be safe. The earlier a problem is found, the easier it is to treat. And when it comes to bowel changes, listening early could mean everything. New or changing skin spots. Not every spot or mole on the skin is harmless, especially after the age of 60. A new mark or a change in an existing one could be more than just another age spot. Skin cancer, including melanoma, becomes more common with age, and early signs often appear as something small, easy to overlook or confuse with something familiar. But changes in color, size, shape, or sensation are warning signs that need attention, not assumptions. Melanoma, the most serious form of skin cancer, often starts as a dark or oddly shaped mole that may itch, bleed, or grow over time. It can appear anywhere on the body, not just sun-exposed areas. In seniors, the risk is higher because skin has had decades of exposure to ultraviolet UV radiation from the sun or tanning beds. And while aging skin shows many marks and textures, doctors stress that any spot that stands out or behaves differently should be examined. One of the biggest challenges is that seniors may believe new spots are part of aging. But unlike harmless age spots, cancerous growths often evolve. They may become raised, change color, or have uneven edges. Some may start to feel painful or itch persistently. These changes might be subtle at first, but tend to worsen over time. According to dermatologists, the ABCDE rule helps flag suspicious spots, asymmetry, border irregularity, color variation, diameter over 6 millimeters, and evolving shape or size. Catching skin cancer early is critical. Melanoma can spread quickly to other parts of the body, but when found early, it's often fully treatable through minor surgical procedures. Non-melanoma types, like basal or squamous cell carcinoma, are more common in older adults and usually grow slower, but they still require timely treatment to prevent complications or disfigurement. Regular self-checks, yearly skin exams, and being mindful of new or changing spots are simple but powerful habits. Seniors should also pay attention to areas they can't easily see, like the back, scalp, or behind the ears, and ask someone to help look if needed. The skin reflects many things: sunlight, health, time, but it also holds clues when something's wrong. If a spot doesn't look or feel right, or simply seems new and unusual, it's worth checking. Acting early can prevent far more than discomfort. It can protect life and peace of mind. Difficulty swallowing. Struggling to swallow food or feeling like something gets stuck in the throat is not just a normal part of aging. While occasional throat dryness or mild discomfort can happen with age, ongoing difficulty with swallowing, also known as dysphagia, can be an early warning sign of serious conditions, including cancers of the esophagus, throat, or even the stomach. Seniors are more likely to dismiss this symptom as minor or attribute it to dental issues, acid reflux, or even anxiety. But when it lingers or worsens, it deserves closer attention. In many cases of esophageal cancer, the first noticeable symptom is trouble swallowing solid foods like meat, bread, or raw vegetables. Over time, the problem can progress to softer foods and even liquids. This happens because tumors in the esophagus can narrow the passageway, making it harder for food to travel from the mouth to the stomach. Some patients may begin to eat less, simply to avoid discomfort, leading to unintended weight loss or malnutrition. Two additional signs that something isn't right. Cancers of the throat and upper digestive tract may also cause hoarseness, pain when swallowing, or the feeling of something being stuck even when the throat is clear. These symptoms often develop gradually, which makes it easier for people to ignore them. Seniors who wear dentures or have dry mouth from medications may assume it's just another aging issue. But doctors warn that persistent swallowing problems, especially when paired with unexplained weight loss, persistent heartburn, or pain, should be evaluated as soon as possible. Tests like a barium swallow, endoscopy, or imaging scans can help. Doctors identify the cause and rule out cancer or other structural problems. When caught early, many cancers involving the throat or esophagus can be treated more effectively, reducing the chances of spread or serious complications. It's easy to dismiss discomfort at mealtime, but swallowing is a critical function, and changes to it are never meaningless. If eating becomes uncomfortable, or if certain foods are being avoided due to fear of choking or pain, the body is giving a clear signal. Seniors should never feel like they're just getting older when something changes. If swallowing has become difficult, don't wait. Speak up, get checked, and protect your health before a quiet symptom becomes a serious problem. Ongoing cough or hoarseness, a cough that doesn't go away after several weeks, or a hoarse voice that lingers without reason should not be ignored, especially in people over 60. While it's common to assume a lingering cough is due to allergies, a mild cold, or seasonal irritation, persistent symptoms can sometimes point to something much more serious. Doctors warn that cancers of the lungs, throat, or thyroid often begin with changes that seem harmless at first, but slowly worsen if left untreated. Lung cancer, in particular, is known for developing quietly. One of its earliest symptoms is a chronic cough, often dry, sometimes with phlegm, and occasionally with streaks of blood. Many seniors assume this is just a smoker's cough or a side effect of another condition like acid reflux or asthma. But when a cough stays longer than 3 weeks, especially if it worsens over time or disrupts sleep, it should be evaluated. Even non-smokers can develop lung cancer, especially with a history of second-hand smoke exposure or long-term exposure to pollutants. Similarly, hoarseness that lasts more than a couple of weeks can be an early sign of throat or thyroid cancer. The vocal cords may be affected by a tumor pressing on nearby nerves or tissues. Seniors might think this is due to overuse of the voice, dry air, or aging vocal cords. But persistent changes in voice, especially when paired with a sore throat, difficulty breathing, or a lump in the neck, should be brought to a doctor's attention. Medical professionals may order a chest X-ray, CT scan, or laryngoscopy to examine the source of the symptoms. If cancer is involved, early detection gives the best chance for successful treatment. But even if the cause turns out to be something less serious, identifying and addressing it early can improve comfort and peace of mind. A lingering cough or hoarse voice might seem like a small annoyance, but the body doesn't send signals for no reason. Seniors should trust their instincts. If something feels off, if it doesn't go away, or if it gets worse with time, it's time to act. Speaking up sooner could mean catching something early, preventing something bigger, and protecting years of health ahead. Unexpected bleeding. Any unexpected bleeding, from the stool, urine, or coughing, should never be brushed off as minor, or assumed to be something harmless. In people over 60, these signs can be linked to serious conditions, including cancers of the colon, bladder, kidneys, cervix, or lungs. Seniors often think a little blood is due to hemorrhoids, a urinary tract infection, or a small sore, but doctors warn that even small amounts of unexplained bleeding deserve immediate attention. What seems like nothing could be the body's early way of alerting you to a deeper problem. Blood in the stool can indicate colon or rectal cancer. It may appear bright red on toilet paper or be darker and mixed into the stool, giving it a tar-like appearance. Many older adults assume it's hemorrhoids, especially if they've had them before. But the key difference is duration and frequency. If the bleeding returns repeatedly or is accompanied by changes in bowel habits or abdominal discomfort, it's time to get it checked. A colonoscopy or other simple test can often find the source quickly and safely. Blood in the urine can be caused by bladder or kidney cancer, even if it only shows up once. Sometimes it's visible, and other times it's only detected through routine urine tests. Seniors who ignore this, thinking it's dehydration, medication side effects, or a passing issue, may miss the chance to treat a cancer early when it's still manageable. Coughing up blood, even in small streaks, can also be a symptom of lung cancer. It's easy to think it's from dry air or throat irritation, but when it happens more than once, it should be brought to a doctor right away. Unexpected bleeding of any kind, especially when there's no clear reason, should never be left to guesswork. It may be uncomfortable to talk about, but early diagnosis can save lives. In many cases, cancers that cause bleeding can be caught and treated early with better outcomes, especially when the patient doesn't delay in speaking up. Seniors should always remember that their body's signals matter. Bleeding is never something to wait and see about, whether it's once or ongoing. Getting it checked provides answers, eases worry, and most importantly, gives a chance to act before things become more serious. It's not about fear, it's about giving your health the respect it deserves. 8. Lumps or thickened areas. A new lump under the skin, or an area that feels thicker than usual, should never be assumed to be part of normal aging. While not every lump means cancer, any new growth that feels firm, doesn't move easily or gradually, increases in size can be a warning sign, especially in people over 60. These lumps may appear in places like the breast, neck, armpit, groin, or abdomen, and often go unnoticed or unspoken about because they aren't painful. But doctors caution that a painless lump can sometimes be more concerning than one that hurts. Lymphoma, a cancer of the lymphatic system, commonly presents as swollen glands in the neck or underarms. These may feel rubbery or firm and don't typically cause pain. Breast cancer can also present as a lump, not only in women but in men as well, especially as they age and hormone levels shift. A lump that seems to sit in one place or gradually changes shape is always worth further evaluation. In some cases, soft tissue sarcomas or other rare cancers may cause firm growths deeper under the skin, which might be mistaken for muscle knots or aging tissues. Many seniors dismiss new lumps as fat deposits, scar tissue, or simply part of getting older. But doctors emphasize the importance of getting any lump evaluated, particularly if it wasn't there before, feels harder than surrounding tissue, or has started to grow. Even long-standing lumps that begin to change shape or texture should be looked at again. A physical exam, imaging scan, or biopsy may be recommended, depending on the location and how the lump behaves. Waiting to see if it goes away on its own can delay diagnosis and limit treatment options if cancer is involved. While the majority of lumps are harmless, the risk of cancer does increase with age, and being proactive is the best way to stay ahead of serious problems. Early detection is key, and many cancers found through self-exams or routine physicals are treatable with better outcomes when caught in the early stages. The body knows how to signal when something isn't right. A lump may be small, painless, and easy to miss, but it's never too small to matter. Seniors should never feel embarrassed or hesitant to bring it up. When it comes to lumps or thickened areas, checking early can be the difference between peace of mind and a problem caught. Too late. Your body speaks in quiet ways, through little changes, unusual feelings, or new discomforts. And while aging brings many normal shifts, it's important to know when something might not be so harmless. These 8 symptoms aren't meant to cause fear, but to remind you that early action matters. Many cancers, when caught early, can be treated or even cured, but they often hide behind symptoms that seem ordinary until it's too late. So please don't wait. If something doesn't feel right, get it checked. You're not overreacting. You're protecting your life, your time, and your peace of mind. If this video helped you understand your body a little better, give it a like. And if you want more clear, honest health tips made just for people over 50, hit that subscribe button now. We're here to walk this journey with you, one helpful step at a time. And if you know someone this video could help, share it with them. You might just change a life today.